and good afternoon. It is Friday, and that means it's time for our Lunch and Learn. Now, today we're going to be talking about progesterone. So if you are female, you know that you produce males too, but we're talking to the girls today because we're talking about the importance of progesterone and how this is often overlooked, and some studies that show why it shouldn't be overlooked, and then some products that we have to help you if this is something that you need. So women do 3 hormones. Men do the same: estrogen, progesterone, testosterone. The males major on testosterone, the women major on estrogen, but both sexes produce all 3 hormones. Now, normally when a woman goes through menopause, she stops producing the estrogen because she stops being fertile. So estrogen is the hormone that makes us fertile. When we are young women, when we are teenagers and we come in to maturity and we become fertile, because of the interplay with the hormones, we can get the PMS, we can get the hormonal acne, the cystic acne, and that kind of thing, because the body produces, as I said, estrogen, progesterone, and testosterone. Testosterone is a minor player for women, but it's still there and you still need it. But the estrogen and the progesterone, they play off of each other. And the first 14 days you have one of them, the second 14 days you have the other one. And so if they're not in balance, then this is when we get those problems. So when we are older and we are in menopause and we are having hot flashes and vaginal dryness and all the different symptoms that we can have, anxiety is one, losing your hair is one, heart palpitations is one, then we are looking for alternatives. We are looking for something that we can do. We don't necessarily want to be fertile, right? But we do want to be healthy, and we do want to make sure that things are functioning the way they need to. Now, I am not, NOT, a hormone expert. I am not. I have attended various courses, and this is one that I did, which was all about heart disease and estrogen. So estrogen, progesterone, all the things. In fact, all the hormones. This doctor was really good. He was a medical doctor, and I really enjoyed him. But you can see how thick this binder is, and you can see I've got all kinds of notes and sticky flags and all that kind of thing because I refer to it often. I am not an expert on hormones. However, I have been able to manage my own journey through menopause with very minimal help from the medical profession. And so I want to give you some information so that you can manage your own hormones. I don't think that we have to be in distress because either we have PMS or we are postmenopausal. So this is primarily going to be directed to postmenopausal women, although women that have PMS, you're going to want to hear this as well. So estrogen is a hormone that helps us to become pregnant. Progesterone is a hormone that helps us keep the baby and nourish the baby, and that's why the hormone is called gestation. Think of gestation, right? And so we have estrogen that peaks, and then we've got progesterone, and right in that, where they come together, you've got the ovulation happening when we drop that egg, and hopefully it gets fertilized if we want to have a baby and that kind of thing. So the interplay between estrogen and progesterone is profound in fertility. When we are past our fertility stage, we still need both hormones in order to live a healthy life. And so we're going to be talking about this. The medical profession, by and large, only focuses on estrogen. And when you have estrogen unopposed by progesterone, you're going to have some issues. So think of estrogen as the gas pedal. Think of progesterone as the brake. So when you're driving, primarily you use the gas pedal, but if you don't use the brake, you're going to be in big trouble. Same thing if you're only doing hormone replacement with estrogen and you're not doing that progesterone, you're going to be in real trouble. Sometimes you need to have testosterone as well. That's why we do blood tests and all that kind of thing to see where you are. However, there are doctors And we don't want you to be going to one of these who will only give you estrogen and they will not give you progesterone as well. So there's a growing body of evidence that suggests that progesterone deserves more emphasis as an intervention for hormonal issues. So the primary role of progesterone is to modulate mitogenic and proliferative effects of estrogen. So you may be aware that there are cancers, breast cancers particularly, that are estrogen dominant. And that means that if you have a high level of estrogen, that you're going to grow breast cancers, and we don't want to do that. So one of the things I want you to understand before we even really get started in this discussion is there is a huge, and I want you to hear huge in big capital letters with a lot of exclamation points behind it, that there is a huge difference between bioidentical hormones and synthetic hormones. Synthetic hormones have a lot of side effects, including cancer. We do not suggest ever, never, ever, ever that you do synthetic hormones. If you need hormones, then we want you to consider doing bioidentical. Yes, there is a cost factor because your insurance does not cover it. However, and I heard another naturopath say this, and I thought it was very good and a very good way of explaining this. She was talking about the anti-prolific effect of progesterone. So we know that over amount of estrogen in our body produces cancer. If we don't have the progesterone, that's how we get the cancers and that kind of thing. But also the synthetic estrogen also leads us into breast cancer. And so she was asking the doctors why they're giving their patients the synthetic estrogen. And the doctor said, well, because they have hot flashes and this is going to make them happy and it's affordable, blah, 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 blah. And the naturopath said, yes, but you know that the synthetic estrogen is going to give them breast cancer. He said, yes. He goes, but that's going to be about 10 years down the road, and they're going to be happy with me for 10 years. And she said, but if you would give them an informed choice, I can give you this, but you're probably going to have breast cancer in 10 years. They're probably going to opt for the hot flashes rather than to go into the synthetic hormone world. So I thought that was a really good way of explaining it. And unfortunately, medical doctors do not give you the whole story. Don't know why they don't give you the whole story, but they just don't. And so this is why we do our own research, and this is why we are our own best advocate, because it is very, very important that we have the whole story. So estrogen is responsible for cellular division and growth, which was the reason why it is in the body when you are coming into maturity. This is a hormone that helps us develop breasts and secondary sex characteristics, all that kind of stuff. And so we need it. Progesterone, though, puts the brake on that. And we need that as well, because otherwise, as I said, we're going to have these hormonal issues, breast cancer, hair loss, acne, and that kind of thing. So we want to make sure that we're able to balance both, and that's what this report is all about. So the symptoms of excess estrogen include leg cramps, uterine and breast fibroids, accumulation of fat in the hips and the thighs and in the back of the arms, and vaginal bleeding. Progesterone keeps estrogen from going rogue and growing things where it shouldn't. Now, I will also just say that if you do have fibroids in the uterus or in the breast, you might also want to look at your thyroid, because not having enough iodine also will cause fibroids. And so we're all interconnected. And while this report is about progesterone, and we're going to be talking about that, you also want to look at your iodine stores too, because most of the time when we find fibroids, we find a very, very low functioning thyroid. So just going to throw that out there. Progesterone and estrogen do a dance together. It's really important that no matter what estrogen is doing, progesterone is there to support it and regulate it. estrogen dominance is not just a case of excess estrogen, but estrogen unregulated by progesterone. No matter how much or how little estrogen a woman produces, unmitigated estrogen can cause hormonal imbalance. So this is why this is important for fertile women as well, because if you have very long periods, if you have very hard periods, if your periods come more frequently than 28 days, and you probably have a hormone imbalance, and that can be rectified very, very easily by talking to a professional that knows what they're doing and can help you with that. So we do energetic testing, as you know, if you listen to this program regularly. We do energetic testing, and so we can ask the body, what do you need? Where are you out of balance, and how can we help you? So factors such as excess weight, hormonal contraceptives, stress, and lack of sleep all increase estrogen production, making it even more difficult to maintain the balance between estrogen and progesterone. Xenoestrogens are substances that mimic the effects of estrogen, such as glyphosate, and we see this in Roundup, pesticides, and parabens, which also contribute to the increase in estrogen levels. I'll tell you what else does. Meat that is not organic. All of our meat, all of our dairy products, our poultry, all are treated with hormones and antibiotics. When you eat food that is not organic from those categories, you are getting antibiotics and you are getting hormones. So that increases your estrogen level in your system, and that can predispose you to cancers. Now, I'm just telling you, the industrial farming companies do not use bioidentical estrogen, okay? They just don't. They use the synthetic because it's the cheapest. So just be aware of what you're putting in your body. A 2020 study aimed to shift the focus of women's health from estrogen alone to a more comprehensive view, which included progesterone. The authors emphasized the need for more studies to support the research between the two different hormones. So many doctors have taken a cautious approach to prescribing progesterone due to studies linking excess progesterone to blood clots and thrombosis. Now, thrombosis is just another word for blood clot. It's a more serious type of blood clot. So Carol Peterson, who is a registered pharmacist and a certified natural practitioner, emphasized the difference between bioidentical progesterone and the synthetic version, progestin, which is usually prescribed along estrogen in hormone treatment. Okay, progestin is created in a lab. It mimics the naturally occurring progesterone, but has different side effects and safety concerns. Synthetic progestins, like those used in birth control and intrauterine devices, have been found to result in high blood pressure, hair loss, anxiety, depression, and an increased risk in breast cancer. Now, there is a huge difference. Another study found that natural progesterone used with estrogen in hormone replacement therapy does not increase the risk, unlike progestin. So this is why we never, ever recommend synthetic hormones. We always, if you're going to do hormones, we want you to do the natural kind, because we don't want to have any kind of breast cancers or even cardiovascular issues. This study that I went to with this medical doctor, he said that 95% of cardiovascular events in women occurred when they were postmenopausal. And that is because of the balance of estrogen and progesterone is off, right? We know that we don't have a lot of estrogen when we go postmenopausal. And so every woman, me included, and I do, needs to supplement with bioidentical estrogen, because bioidentical estrogen protects your heart. Synthetic estrogen is linked to cardiovascular risks. So synthetic progesterone also is linked to cardiovascular risk. So for that reason, along with breast cancer, we choose to do the bioidentical. So another study demonstrated that natural progesterone and some of its derivatives do not exert any androgenic effects on the heart and have no negative impact on the lipids affecting cardiovascular health. Cardiovascular disease is one of the most significant health risks in older women and was the impetus for the Women's Health Initiative study in the early 2000s, which abruptly was halted by the researchers when they found that the women taking a combination of estrogen and progestin had an increased risk of breast cancer, heart attack, stroke, and blood clots. Now, these women were taking synthetic varieties, not the bioidentical varieties. So this is what you need to know. Many women go through life with a progesterone deficiency. There is a lot of ignorance about what progesterone deficiency looks like, especially in practitioners and in the patients. And again, I am not the leading expert on hormones, right? I know what I know, but there's a lot of things that I do not know. Some things that we can help you here, but if you are severely out of balance, we refer you to other people who know more than I do, and they can help you in a better way. So women are often told that estrogen is the cure for hot flashes. However, there's an article in the Harvard Health Publishing website about menopause that says the most effective treatment for severe hot flashes and night sweats is estrogen. Peterson, who we just talked about earlier, deviates from this popular opinion. She cites research from Geraldine Pryor, who is a professor of endocrinology and metabolism at the University of British Columbia in Vancouver, British Columbia, who has spent her career studying the effects of the menstrual cycles, changing estrogen and progesterone hormone levels on women's health. Her research states that progesterone effectively treats vasomotor symptoms such as hot flashes and night sweats, improves sleep, and may be the only therapy that symptomatic women who are menopausal at a normal age would require if they don't have osteoporosis. Now, if you have osteoporosis, you're going to need estrogen therapy. This girl believes that you need both. God gave us both. I think we need both. I think they need to be in balance. That's what I do. Okay? This is what I do. And so I want to protect my heart. I want to protect all the things that I need to protect. I don't want any postmenopausal symptoms. And so I take estrogen and progesterone. I'm going to show you some products that I take myself, and I'm going to show you some different things, how you can use it to mitigate, to see what's going on there. So progesterone is very, very easy, and there's no upper limit of what you can take that would cause any kind of problems, whereas estrogen has to be in a certain bandwidth, because if you have more than that, and everybody's different, so it's different for everybody, then you are in danger of creating tumors and that kind of thing, because that's what estrogen does. Estrogen helps things grow. All right. And that's why we want to be really, really careful with the estrogen. So prior studies also demonstrate that along with estradiol, the pivotal female sex hormone, progesterone is crucial for increased bone formation through progesterone-specific osteoblast receptors. Women often experience a decrease in bone density during menopause, which may result in a heightened risk of fraction and breakage. So I just want to break this down for you because this is really important. We know through the research that when the estrogen levels drop off, estrogen helps keep our bones strong, and osteoporosis happens around the menopause time because we don't have the estrogen. This research by Geraldine Pryor says that the osteoblasts have progesterone receptors, and that's how you keep your bone strong. So let me just kind of break that down for you. You've got on your bone, you've got osteoblasts, and you've got osteoclasts. Osteoclast is your bone is here. Some bone cells are dying, so you cast them off, you slough them off, right? Osteoblast, your bone builds new bone cells, and so your bone gets stronger. Geraldine Pryor says that if you don't have enough progesterone in those receptor sites, that it's going to hamper your bone restoration. And so you need both estrogen, but you also need progesterone as well in order to be really, really healthy. There is a stigma against progesterone with the medical community, given its confusion, or its conclusion that progestin causes heart attacks and breast tumors. We're not discounting that. We're not saying that that's not true. What we are saying is that natural progesterone does not have those side effects. Progestins are one molecule different, than progesterone, but that one molecule is significant. All right, it's absolutely significant. It is a big, big deal. So according to Peterson, progesterone receptors are all over the body, and it is a critical hormone that performs many different functions that create a high demand for it. Therefore, she advises against the orthodoxy of starting with a lower dosage and incrementally increasing it. She often recommends to her patients to start high and then go higher until the symptoms find resolution. If progesterone is underdosed, she said patients could be in a worse situation than when they started. Unlike estrogen, she said, one could literally bathe in progesterone with no serious side effects. Women often experiment with various methods of intake, including oral, transdermal, and suppository, to find the dosage and delivery mechanism that works the best for them. So she says sometimes it can take hundreds of milligrams for patients to reach calm. So we know that the B word is used for postmenopausal women, right? We know that. And that's because of the hormone, the imbalance in the hormones. And that's what this doctor, when I went to his seminar, he said, you don't want to just replace the hormones. You want to balance the hormones. And so a lot of people think, well, any amount will work. No, not any amount will work. You have to balance them. They have to work correctly for you, for your individual body. And so that's really, really important. Now, one of the things with natural progesterone, if you have a superabundance of it, you can be more prone to yeast infections. So we don't want that to happen. We don't want you to have that. So just, start at whatever dosage your doctor recommends. And then if your symptoms are not resolved, then you can go higher and, you're not going to be in trouble. You might have a yeast infection, so that is something that you have to consider. So progesterone is synthesized from a chemical called diogenin, which comes from wild yams or soy. So a lot of times when you see natural progesterone, you're going to see that it is made from wild yam or soy. Now, in the United States, I'm not a fan of soy products because about 95% of our soy is genetically modified. And so that means it's got heavy metals and different things. And we don't put that in our bodies because it causes sickness and disease, especially gut issues. So be careful where you get it. I'm not even a fan of soy milk or anything like that because unless it says USDA organic, it is genetically modified and it's going to cause you a lot of gut issues. But the human body cannot make progesterone from diogenin. So eating wild yam or soy will not boost the progesterone levels. Zinc-rich foods such as oysters, beef, egg yolks, liver, nuts, seeds all increase progesterone production. A healthy diet of exercise, proper sleep, stress management, and food choices keep the hormone balance in check. All right? If you're not sleeping, if you've got too much stress, if you're eating too much processed food, you're going to have a lot of problems. And so we want to talk about some different things that you can take. So this is probably my favorite product. It is a Pure Herbs product, and it is an adaptogenic formula. So as a human, postmenopausal woman, I have a need for both progesterone and estrogen. So this formula will adapt to whatever my body needs. If I need more estrogen, that's what it'll give me. If I need more progesterone, that's what it'll give me. So I like this one because it thinks, and it's really, really good for postmenopausal women. It's also good for women who have hormone imbalances that are younger, still fertile, but as I said, they've got hard periods, or they've got periods that come too frequently, or they've got really heavy bleeding or whatever. I like this one. We also have a progesterone cream. Now, this cream is formulated by Dr. Julia T. Hunter, who is a friend of mine. She has a practice out in Beverly Hills, California, and that's where she is, but she travels all over the world, and she is a friend of mine, and she makes both estrogen and progesterone. If you're going to be doing estrogen, which you should, you also need progesterone, because estrogen does not need to be unopposed. It has to have gas pedal, brake pedal, gas pedal, brake pedal. So this is really good if you prefer a cream. I like that. If you are a younger woman and you're not postmenopausal, you probably are making enough estrogen but not enough progesterone. So the Dong Quai is an herb that you can take, which helps your body metabolize more progesterone. Sometimes, we've got the black cohosh and the Dong Quai. We've got it separate, but we've got it all together in this formula. So some of my younger people that come in, we will test for one or the other of these. And one of them, the cohosh, is to be taken day 1 through 14. The Dong Quai is to be taken 14 through 28. And so it is a way to artificially, naturally balance your hormones. Your body's not doing it by itself, but these natural, holistic, organic ingredients can help you with that. And so what is the main takeaway that I want you to have today? I want you to understand that women, for all of your life, post-puberty, you're going to need estrogen, you're going to need progesterone. Most of us, we go into our about 50, 55, something like that. Estrogen production drops off. We quit becoming fertile. And so we need to have supplemental estrogen in order to make sure that our heart is healthy. But we also need supplemental progesterone, because estrogen helps things grow. Progesterone stops that. And so when we're doing synthetic hormones, which most of the time is what your doctor's going to give you, because that's what insurance covers, made in a lab, very cheap, that's what they're going to give you. Both estrogen and progesterone increase cardiovascular risk and increase breast cancer incidence. So giving you the information, you can make your informed choice. Of course, we're all adults and we can do that. But if you don't know, and most people don't know, and most people, I speak to people every day that go to their medical doctors, and most people every day will say, well, this is what my doctor says, so this is what I'm going to do. You should listen to your doctor. However, you need to be informed to understand a synthetic hormone replacement is going to make me more predisposed to heart issues and cancer issues. A bioidentical hormone is going to help my heart and also not cause the problems with breast cancer. So that's a lot of information. Again, I am not the hormone expert, all right? Sometimes, because I'm not a medical doctor, I don't have access to bioidentical hormones that the pellets and all that kind of stuff. I don't have access to that because I'm not at that level. We do have what I showed you, which for years and years and years I've used, and it has been absolutely brilliant. Sometimes you need more, okay? But if you don't need more, then we've got these offerings for you. But what I want you to do is to be aware of what's going on so you can not suffer in silence just because you're at that certain age of maturity when your body is not producing the hormones that you need to live a happy and healthy life. So if you're finding yourself a little bit on the irritable side, it could be because your hormones are not balanced. And so progesterone would be something that you are missing. So it is the weekend. Thank you for joining me today and giving me your time. I feel like that's such an honor. We want to thank you for liking, commenting, sharing, all those kind of things. And I want you to go in the weekend and relax, recover, rejuvenate, and I will see you next week. Thank you so much.